Have you ever heard the comment, they're doing surgery as part of gender affirming care on children? Have you ever heard that? If you have, I want you to think about what your response is to that, what you think about when you hear that. I'm going to tell you that's what I'm going to tackle today in this episode. Let's break down that sentence. Let's see what's fact and what's fiction. Let's understand what is going on. And let's talk about who's affected by gender affirming surgery. So first, before I go into all of that, let's talk about this episode. This episode is for you. If you heard that statement, you do not understand. If you're thinking, that's curious, I don't understand why medical providers would do gender affirming surgery on children. If this is you, this podcast is for you, because by the end of this podcast, it will make sense to you regarding what is going on, what is being done, and what's being offered. This podcast is also for you if you're unsure what to say when people make that comment, because you know that's not completely correct. You will know how to respond to that by the end of this podcast. And finally, this podcast is for you if you're a healthcare provider. Because as a healthcare provider, we know we can't know everything about every aspect of medicine. However, we do need to know the facts and the general baseline standard of care for practices. So this is going to help you with that as well. So let's get into it. The statement, they do surgery on children as part of gender affirming care. Let's break it down. Now, surgery, we're going to break it all down because we want to make sure we're on the same page, right? Surgery by definition, and I'm summarizing from the American Medical Association policy definition of surgery because it's quite a long definition. But basically what they're saying is anytime you either make an incision in tissue or destroy tissue, whether that's removing it or cauterizing it or whatever you do to it, that has a local effect on that tissue. And they list all the different tools you could use for surgery. But basically it has a localized effect on what you're doing that either changes the tissue in some way, moves the tissue in some way, alters the tissue in some way, and has a localized effect. That's not usually is not a localized effect. It goes through the whole system. So we're not talking about that. Surgery is an incision or a destruction of tissue, a change in tissue that alters things. I think this is really important because technically, puberty blockers can be given as an injection, which would not be surgery. But it can also be done through an implant. The medication can be given in a capsule and implanted in the arm, in which case the medication's not a surgery, but the placement of the implant, because there's an incision in the skin, you alter the tissue, you sew it up. That can be considered a surgery. So we have to be really clear about what we mean in surgery. Now, I'm guessing that most people, when they hear that sentence, they're doing, for gender affirming care, they're doing surgery on children. I think they're thinking about operating room, top surgery, bottom surgery, something like that. Top surgery is exactly that. We're talking about chest tissue, whether that's augmenting the chest, adding to it, enlarging it, or whether that's removing breast tissue from the chest. Bottom surgery is exactly that. It could be creating a vagina, it could be creating a phallus, something along those lines. The other gender affirming surgery that comes to mind, although not done in minors, is female feminization surgery. That's the alteration of the face to give it more feminine features. So I think it's really important when somebody's giving you that statement, what do they mean by surgery? Because if we talk about the placement of a medication as surgery, that's done on many kids, but in particular transgender kids, then it may be done at younger ages, because puberty is blocked depending on the person and when they begin puberty, because puberty must begin before you can block it. Yeah, there's a wide variety, and that might fall under the age of children. But I don't think that is the image most people have. So let's talk about gender affirming care too, because it's not that they're doing surgery on kids, it's gender affirming surgery on kids that gets people with a reaction. So let's talk about what we mean by gender affirming care. And according to the World Health Organization, they defined it as a single or a combination of a number of social, psychological, behavioral, or medical, including hormonal treatment or surgery, interventions designed to support and affirm an individual's gender identity. Now, in this episode, we're talking about surgery. So there are other ways to be gender affirming, but we're talking about gender affirming surgeries. So meaning a surgery that is designed to support and affirm someone's gender identity. The thing to be aware of with this definition is that they're not specifying that it is for somebody who is transgender or non-binary. With this definition of gender affirming care, we're just talking about for anyone's gender identity, which means gender affirming care or gender affirming surgeries can be done on cisgender people. I'll give you an example. Breast augmentation, that's gender affirming surgery. That somebody feels that that surgery will support their identity, affirm them. And another top surgery that's gender affirming care, regardless of how you identify, is when breast tissue is removed. So there is a condition called gynecomastia. Gynecomastia is breast tissue in the chest for a body that has a testosterone-driven system. The testosterone is driving the development, and they at the same time develop breast tissue in their chest. That's called gynecomastia, and some men that have this want it removed. And so whether they're transgender or cisgender, they want it removed. So this is a gender affirming surgery regardless of how the person identifies. But I think the word that is most problematic in that sentence that can vary person to person on how we're defining it is the word children. They're doing gender affirming surgery on children. And just to show how difficult it is, I want you to think when you hear that sentence, they're doing gender affirming surgery on children, what ages are you thinking of? What are you picturing? Who are you picturing? Who does that include? So think about that for a second. And I'm sure if I asked many of you, I'm going to get different answers, which makes sense because in Merriam-Webster dictionary alone, there are 4 definitions, but 2 of them really come to mind here. One says a child is a young person, especially between infancy, so a year-old, and puberty. So between infancy and puberty, that's a child. And then there's another definition within the dictionary that says a person who has not yet hit the age of majority. Age of majority in the United States is 18. Some countries it's 16. I'm sure there are other ages in other countries. But that's important. That's completely different. Between infancy and puberty is completely different than until the age of majority. So when people say they're doing gender affirming surgery on children, what is their definition of children? Because even if we go, the medical definition. So when you look at medical dictionaries and look for the definition of children, it varies just as much. Some that I looked at said infancy to puberty, so it did say that. Some said up until the age of 12 is a child. Some said up until the age of 18 is a child. So we have a great variety, even in the medical literature, of how child is defined depending on what you use for your definition. So this in particular, I think is really important to define. So what is being done from a surgical perspective for gender affirming care? Remember, gender affirming care is regardless of whether somebody's transgender or not. It is just gender affirming care. But let's talk about the transgender community. So within transgender children, top surgery may be offered. There are a lot of hoops to go through to get it. There has to be, again, every surgeon is going to be different on what they require. But nowadays, it's not just about what the surgeon wants. It's also what the insurance wants and the reasons and everything. So there is a large evaluation between therapists are often involved and have to say, yes, this is who the person is and what they want. Sometimes there have to be letter supports from people in the community, people in the child's life saying, yes, this is who they are and this is what they want. There has to be some relationship to a provider, medical provider, etc. So there are a lot of hoops. And I will say that I don't think there is any other aspect of medicine that requires more hoops. There's a few I can think of that have quite a few hoops, but no more hoops than this for the transgender patient. If we look at those same surgeries, whether it's breast augmentation or breast tissue removal, either of those in the cisgender population, I don't think you're going to see the same number of requirements to have that done. So that's one discrepancy, and we have to ask ourselves why. If we think we need to be so sure that somebody's going to change their body, Why is that not the case for everybody? But let's talk about for transgender and non-binary individuals when this is being offered. There is no standard as far as at this age you can offer the surgery. It is often taken into consideration. Many times it's the patient requesting it and the patient saying, hey, I don't want this. I want this to change. In which case it can vary. And so some of the thinking is how much distress is the patient in having these bodily changes? How much dysphoria? How is that distress or dysphoria affecting their quality of life? And then furthermore, the other things that are considered is the support for their identity, and peer concordance is also considered, meaning what are the bodily changes in their peers? Are they very different from their peers, or are they very similar to their peers? So all of these things are taken into consideration, and then the decision is made. It is done because the distress, the dysphoria a patient may feel can affect their quality of life. And if surgical means is a way to affirm a person, is a way to improve their quality of life, that's why we call it life-affirming care. That's why it's life-saving care. But this is not taken lightly among the transgender and non-binary population. Again, different from the cisgender population, but from the transgender non-binary, many hoops to go through, many checks and balances. We can discuss at another time whether that's right or wrong. It doesn't matter. That is the case. So that is why it is done. But now when we think about that term children, so is it being done on children? Typically, if we define child as anyone the age of 12, then the answer is no, because some amount of puberty has to begin and chest development has to be there in order to remove it. I think it is extraordinarily rare for chest augmentation before the age of 18. I could be wrong, but I have not heard of a case. That doesn't mean there isn't one. I just think it's extremely rare. The other aspect of of this misinformation of saying it's done on children, if you define children as under the age of 18, then you are correct. It is done on children under the age of 18. But how, at a rate of what? That is the big question. And so I want to talk about a recent study. That's why it's on my mind right now. A recent study that looked at exactly this gender-affirming surgery in all patients. And they looked during the year of 2019. And I'll talk about why that's significant and why that's a great year to look. But in the year of 2019, they went through millions of charts, and they looked at ICD codes, the insurance codes. And so that means there's a little limitation there. It means everyone had to have insurance and be using insurance for these ICD codes. So they looked at millions of charts, and they looked at how many surgeries were being done and on whom. So the first they looked at how many gender-affirming surgeries were done in individuals that had a diagnostic code of being transgender or gender dysphoria. So among adults, there were 5.3 out of every 100,000 had a gender-affirming surgery. 5.3 out of every 100,000. When they looked at 15 to 17-year-olds, there were 2.1 gender-affirming surgeries per 100,000 people. 2.1 per 100,000. Then when they looked at 13 and 14-year-olds that had gender-affirming surgery with diagnosis of transgender gender dysphoria, 0.1 out of 100,000 for 13 to 14-year-olds. 0.1 out of 100,000. And then the last category was looking at those 12 and under. How many gender-affirming surgeries for those that identified as transgender, or that had the diagnosis of being transgender or having gender dysphoria? How many gender-affirming surgeries do you think were done on those 12 and under? The answer is 0. 0 surgeries were done, which again, not a surprise to me at all, but just confirms with some data. But here's the thing, when they looked at the minors, so anyone under the age of 18, who had, so in this case, it's anywhere between the ages of 13 and 17, who had a chest procedure, had a chest reduction, they looked out of 151 chest reductions, 151, 146 of them were done on cisgender males. So 97% of the gender-affirming chest surgeries were done on men, on boys, between the ages of 13 and 17 were boys, cisgender boys. So the other 5 were transgender. So when we look at gender-affirming surgery, first off, very low numbers. If you use the definition of child as under 12 and under, they're not being done. And they're being done in very small amounts for those that have the diagnosis of transgender and gender dysphoria based on this study. I think this is really important because one thing I will say as a medical perspective is when there are legal implications to medical care, it affects more than the people targeted. What I mean is if you remove gender-affirming care as part of the treatment, even though it is a standard of care that multiple medical associations support and affirm, even though that, if you legally take it away, it is going to affect more than transgender individuals. And you say, well, no, but we can clarify it's for transgender individuals. My experience within medical practice, when there are legal implications for a procedure, if that procedure is done for a different reason, same procedure, different reason on a different group of people, many providers are afraid to provide it because they're afraid of being accused of lying about who the patient is. Now, if you're like, I don't follow, let me give you an example. Abortion is a great example. So the procedure for an abortion is the same procedure as somebody that does not have a complete miscarriage. And with a complete miscarriage, you can offer to watch and wait and let the body pass themselves. Or if you don't want to wait, you can offer surgical procedure. But that surgical procedure is the same one as done for abortion. In many places where there are laws against abortion, providers are not offering a surgical option for those patients that have an incomplete miscarriage because they're afraid of being accused of doing an abortion. So they just don't offer it. They don't want to. And if you think, well, but if they're not doing an abortion, it should be fine. But they may get accused because the person accusing them may or may not know how to read an ultrasound. There has to be an investigation. And even if they're cleared in the end, in the time of investigation, they may lose privileges of seeing patients, which is going to affect their patient care. It may affect their reputation. And so many people don't think it's worth it. There is more. First of all, I don't think it's okay to get rid of gender-affirming care, period. But I also think it's my responsibility to bring up to you the other effects of it. It affects more than the people that you target. Now, for me, it's enough to say that it affects anybody. But I know for some of you listening, you need to realize that it has a greater effect. I also encourage you to look at, if you think it's different to provide gender-affirming care for a cisgender boy compared to a transgender boy, what's the difference to you? Why are they different? And I'm going to offer one guess. My guess is if you view those two things as different, you do not view the transgender boy as a boy. And that is where you and I will be different. When people ask me what I think about the statement they're doing gender-affirming surgeries on children, because I picture children as people prior to puberty, I would say, no, they are not. And those that are under the age of 18 that have surgery are doing it appropriately and for a reason. And I fully support it because that is the best medical care. That is the standard of care. And I support it. Have a great week.